Dr. Monique Dosteleur strives to improve patients' quality of life, focusing on living and not dying. She has a way of helping patients and family focus on the positives, no matter how small and even in the darkest times. Her unwavering compassion is seen every day with patients as she takes the time to sit quietly at their side and truly listens to patients and families. Dr. Dosteleur stepped into the medical leadership role for complex continuing care, rehabilitation, palliative care, and family practice, where she shares her knowledge and expertise, provides guidance and support, and is considered a mentor. Dr. Dosteleur has been recognized by her colleagues for exemplifying a sense of community amongst peers and for her commitment to ensuring that patients' dignity is maintained through quality, compassionate medical care. Dr. Dosteleur spends quality time with every patient to understand how they are feeling and how their personal lives are being affected by cancer. She has been a key facilitator for integrating palliative care philosophy into the oncology department and works collaboratively with the medical oncologist to establish this model of care. She advocates for patients and promotes tools and models to manage every aspect of the patient experience. What we do and how we treat others matters. That's the motto that Dr. Charles Weingard lives by. The medical director of rural health lives this not only in his care of patients, but in his interactions with his coworkers. With 40 years of experience in counseling, psychotherapy, and emergency medicine, Dr. Weingard has achieved a great amount during his medical career, but remains consistently humble, as his primary concerns are continued learning, bettering himself, and most of all, caring for patients. His compassion shines through as he remains humble in the face of such success. Dr. Weingard promoted the Choosing Wisely campaign in the CEH Emergency Department to ensure that patients are receiving the right care in the right place without ordering unnecessary tests and adding cumbersome steps to the patient's journey. He is not only patient-centered, but staff-centered, and believes that a trusting and open environment in which opinions are truly valued contributes to better patient care overall. He encourages interactive discussions to problem solve in a way that is collaborative and respectful of everyone's ideas and perspectives. Dr. Weingard enables staff to work effectively and efficiently by being a respectful team leader. An organization cannot meet its full potential without the support and dedication of volunteers like Patient Experience Partner Council co-chair Wayne Gone, with his tireless energy and profound commitment. Wayne demonstrates a desire to help in every way that he can, committing to ongoing process improvement to make Bluewater Health the best it can be for patients, their families, and staff. Recently, Wayne stepped forward to lead as the co-chair of the PEP Council to bring forth a fresh spirit of collaboration and appreciation for the greater good of Bluewater Health. In this role, Wayne starts each meeting with a reminder of Emily and highlights her significance to ensure that the council never loses focus on why they are there. On his own time, Wayne takes courses and brings this knowledge back to the group so they have the information to make the best of their roles. Wayne's quiet, calm, and professional demeanor is exhibited at all meetings he attends and through the work that he does. On top of the PEP Council, Wayne commits time and energy to the Quality Committee of the Board and the Patient Experience Committee, seeking to make the patient and family experience of the highest quality. Bob McKinley volunteered as a board member for 8 years and continues to volunteer as a non-director committee member and in other capacities to enhance the patient experience. Bob participated in board events and attended numerous hospital functions to keep apprised of what was happening at the hospitals. This is an important quality in a board member, as it helps them make informed decisions about the future direction of the organization. During his term, Bob sat on the board's Quality Committee and Resource Utilization and Audit Committee, ensuring the hospital is fiscally responsible and decisions were made with the best interest of Emily in mind. Bob demonstrates kindness and caring. He acknowledges the senior team and frontline workers for the work that they do and made a point of mentoring new board members, opening his home so they can meet existing members on an informal basis. Bob is passionate about his community hospital. Along with a number of other teachers, Bob started the Pears Trivia Challenge, now in its 19th year, benefiting Bluewater Health Foundation and St. Joseph's Hospice. This commitment continues to this day, as he recently volunteered his time to help make improvements to privacy curtains for our patients. Brent Steeves was a long-term member of Bluewater Health's Board of Directors and the Resource Utilization and Audit Committee. In all his deliberations, Brent thought of what was best for the hospital, the community, and our patients and families. He worked cooperatively, positively, and respectfully with others in the performance of his duties, while exercising independence in decision-making. He listened to the other committee members for their opinions and utilized their unique knowledge. Once decisions were made, Brent would support the direction, even if he held a different view during discussions. As an accountant, Brent was always aware of the relationship between healthcare dollars and the patient experience. He took seriously his responsibility to ensure financial viability and that the organization undertakes appropriate financial planning, optimizes the use of resources and operates within them, and adheres to the Hospital Service Accountability Agreement. Brent sought opportunities to be educated and informed about the board and key issues at Bluewater Health and in the broader healthcare system so he could better support the board in fulfilling its responsibilities and mandate. He always did what was best for Bluewater Health and wanted to make the hospital the best for our patients. On ambulatory care, charge nurse Gail Best inspires and models the way for her team, who feel proud and privileged to work with her. Gail strives to find patient-centered solutions, pulling together departmental and interdepartmental teams to share expertise and form personal connections, leading to positive outcomes. Gail takes the time to listen to each and every staff member and patient she comes in contact with, promoting a culture of genuine kindness. Her demeanor is such that patients and staff alike feel comfortable putting their trust in her. The first to arrive at work and the last to leave, Gail sets up clinics to ensure staff is prepared and organized for optimal patient flow. To maintain a more controlled workday, Gail organized through consultation with physicians and nursing staff a more structured booking arrangement that better accommodates urgent patients and creates more manageable workload. Gail puts others in the workplace before herself. She recognizes everyone as unique individuals with different strengths and needs, and her compassionate nature shines through in her poise, making those she works with go the extra mile to emulate her performance. As a housekeeper in environmental services, John Glowa's involvement with patients, families, and staff shows the compassionate impact one person can have on others' lives. His soft, kind approach to each and every patient and family that he interacts with is to be commended. John is attentive to personal privacy and protects the dignity of our patients. He gives his kindness away without ever expecting anything back. When John became aware that the Palliative Family Lounge was being relocated, he took it upon himself, along with other housekeeping staff, to take a Saturday and make the move on their own. Staff was truly humbled by their actions. They made an empty, institutional-looking room look like a beautiful, restful, holistic place for families to be while they're at the hospital with their palliative family member. John is accountable and trustworthy. He has many people asking him many different things in a day, and he will politely do the right thing, either by taking the responsibility on himself or helping to find the right person to ask. John makes a commitment to excellence and takes pride in his work, ensuring that the hospital is clean and that our patients are safe. Margaret Mai began her career at Bluewater Health over 30 years ago and has had a variety of roles over the last 10 years that support quality, patient safety, and risk management. Margaret is accountable for risk, insurance, and legal situations, requiring a sharp eye and organized processes. This is where she excels, with a commitment to continuous learning and an extreme attention to detail. Margaret has the difficult responsibility of notifying staff of their inclusion in a legal motion against the hospital, and does this with kindness and compassion, ensuring that staff involved is supported. She is also an advocate for patients and families and is committed to timely communication to ensure they are updated throughout a case review. Part of her role is to ensure that quality improvement opportunities that arrive from quality of care reviews are implemented. She does so in a very respectful manner, adding clarity to what is expected. As a former member of the hospital's ethics committee and the coordinator of the research committee, Margaret has a unique perspective on ethical concerns and provides important feedback with both an organizational and patient and family focus.